Hi, welcome back to another Yellow Brick Road parent video. Thank you so much for joining us today. Today we have a video that is a little more toddler specific, and we're going to be talking to you about toddler aggression and how to handle toddler aggression. So Kylie, I'm gonna let you introduce the topic because you're the expert.
So toddler aggression is very common. I'm dealing with this full force in my house right now with my 19-month-old. But this is the age that we see a lot of aggression come out, whether it's hitting, biting, headbutting, pushing, all the crazy things that toddlers are doing.
Like, what happened at my house this morning?
Yeah. They're very common things, but that doesn't mean that we just let them go unaddressed. And so we're going to talk to you today about why some of these things might be happening and what you can do to try to help navigate them.
Yeah, so like Kylie said, it's very normal. Toddler behavior often comes out in what looks like aggression. And so the first thing to do is kind of figure out where it's coming from. So Kylie told us what it looks like. And a lot of times a toddler doesn't know how to express what they want. Okay, let's actually change that. Most of the time, a toddler doesn't know how to express what they want. And so they're doing whatever they can to have control over the situation. So whether they're frustrating, whether they just don't have the power or the control, whether they're trying to get your attention, whatever the behavior is, it's that they don't have the learned skill yet to actually tell you. And so what they're doing is they're trying what's worked for them in the past. And so babies learn everything through their mouth. So almost always you'll see 1-year-olds, 2-year-olds, they'll start to bite because in their experience, crying, eating, everything that's met their needs has come from their mouth. So then they try to see if their mouth can get them what they want in the next way, and they don't know how to talk yet. And if that is successful for them, so if they bite and the behavior stops, or they bite and they get mom's attention, or they bite and they get the toy from the kid, it's gonna reinforce that that behavior then got something. And then that can stem into hitting or kicking or, you know, screaming or, gosh, headbutting. I don't remember all the examples you told me. You're the expert. And so it's them trying to get their need met most of the time. The other reasons it can be, so it's unmet needs, unlearned skill, which we established, and then lack of fit. So they just don't know. They're mad and they're trying to get that anger out of their body. And so then you're going to see some aggression there too. And so again, it's very normal. It's how they're handling their world and trying to experiment with cause and effect to see what works and what doesn't to meet their desired need.
And so what do we do when all this happens? Right? What do? We really want to address what's happening. So, you know, again, we talk a lot about narrating things to the children. Yes. So it's really important during these times to narrate the emotion that that child is feeling. So we'll use my son Bradley. So, you know, Bradley, I see that you're feeling angry, or Bradley, I see that you're sad. Like, why did you bite your brother? You know, and trying to understand the why behind what they're doing and why they're doing it, and addressing that with them and talking through it, and then helping them find a better solution. Although in the time biting might meet their need, that's not what we want them to do long term. Right. So we need to redirect them to a better solution in those situations. So explaining that it's not okay to bite because it hurts. We go back to our social stories there.
Right, yes.
It's not okay to bite because that hurts, but what we can do is we can, you know, ask mommy for please or more help, and, you know, introduce some sign language is great in those moments when they don't have the words to say what they want. So really making sure that we're redirecting them in those behaviors, and knowing, and this is always a hard one for me as a parent too, we get caught up in the like, no, don't do that, no, don't do that, no, don't do that. And we forget to tell them what they can do instead. So big thing to remember about redirection is that if you want to take away a negative, you have to replace it with a positive too, and give them and teach them what they can do instead in those moments when they are feeling mad or sad or angry.
Absolutely. And I think just like Kylie said, you want to be pro-solution, don't ignore the emotion. It's your perception of it. They obviously can't tell you. And so go ahead and label what you think it is to help them make those connections. And the other thing too to remember, and we know how I love to draw my bell curves. So a child's emotion, especially if it's happening out of anger, which is when we'd really call it aggression. So their emotion is like a bell curve, right? So this is the top of the curve where you're gonna see the bite, or the hit, or the kick, or the scream, or the whatever it is. And so scientifically, this area right here is full of cortisol. And so something happens, the stimulus is right here that causes it. So you really have to get right here, or right here after it's over for those teachable moments to happen. If they're at the point where they're hitting and kicking and crying, that's not the teachable moment. If it's a toddler and they just walk up to bite their brother to get him away from the TV and there's not this whole scene, then it's easier to deal with it right here. But if you are dealing with a screaming, kicking toddler, they're not going to get a lot out of it, right? So make sure you either, get it right before the stimuli, right after, or after the end is a teachable moment. That works for your preschoolers too, just so you guys know. Your last little tip here, it's okay to ignore the behavior sometime. If you're on the phone and they're biting you to get you to give them attention, if you're not being really hurt, you can put them in a way and not give them the attention if that's what you think the cause of it is. So keep that in mind too. You're the parent, you're teaching them what's going on, and they don't get to use that aggression to get attention or to get their needs met. So anything else to add on that?
No, I think that's about it.
Oh, thank God you were here, because I couldn't even think of anything besides biting. So thanks for joining us again. We hope these are helpful, and we will see you again next week.